Hi and welcome back to my A to Z series on topics to do with pregnancy and perinatal mental health. My name is Dr. Erin Bow and I'm a clinical and perinatal psychologist and a childbirth educator. Today we're up to I for inductions, and I'm going to talk to you a little bit about my tips for having a reasonably good positive induction experience. This is more from my experience. I'm not a medical doctor, I'm a psychologist, so remember that as we go along. But I think some good preparation is key to surviving this experience and even thriving through it, if that even seems possible. So bear with me. My first tip is to not go down the rabbit hole researching too much, going onto forums and asking other people what it's going to be like. Partially because every labour and pregnancy is different anyway. Everyone's experience of pain, bodily sensation and intensity is different. It's a very subjective experience. But I think the main thing is if you start doing a lot of research, overwhelmingly the information that you're going to find is negative. It will be people telling you that you can't do this without pain relief, that it's going to be horrible, and that it is so much worse than a natural, non-medicated birth. Now, while that may be true for some people, it doesn't have to be that way. And I think fearing yourself into, oh, this is going to be terrible, isn't a great way to prepare for birth anyway. What I suggest you do instead is surround yourself, flood your brain with positive induction stories. So I've got mine to tell you that you can also read more about on my website, but also the Hypnobirthing Australia website has lots of good, positive induction stories that aren't terrible, horrible things that go wrong. Okay, so stick to the positives. Don't get too excited about preparing, because I think that preparing really turns into worrying. And the more that you're fearful and anxious, the more difficult labour is going to be anyway. My second tip is to do a really good childbirth education course. Of course, I'm biased and I'm going to tell you to do a Hypnobirthing Australia course. But I guess the thing I really liked about doing the course personally before I even started teaching it was that you learn about the physiology of your body. So I think because being induced is quite an intense process and it is different from, I suppose, a more spontaneous birth, the sensations get quite quick and strong and there's often not a lot of chance to catch your breath. So I think the thing I liked was learning, okay, this is what my body is doing, this is what's happening. So there wasn't those moments of freaking out thinking, oh, what was that sensation that I just had then? I knew what was happening to me. And also I had really good techniques, breathing techniques, to learn what particular type of breathing to do at what stage of my labour, which is actually pretty important, because it's all very well to say take deep breaths and do all that sort of stuff, but often unless you're taught to breathe appropriately and in a really kind of structured manner, even though it sounds silly and we think we all know how to breathe, most people's idea of a deep breath is actually more like hyperventilating. So they do this, your shoulders come up, everything gets tight, and that's not a deep breath, that's just you starting to hyperventilate. So learning some good breathing techniques, particularly for doing that process of, okay, baby's coming down, breathing the baby down and letting your body relax in between those contractions, or surges as we call them in hypnobirthing, is really important, because it's very easy to tense up and just sort of brace yourself for the next one. So it's really important to remember to just completely flop in between each contraction, and you want to just imagine that you're maybe in the ocean rising up against a big wave. If you let your body go limp and relax, having that huge big wave coming at you is going to be a lot easier to manage than if you think, oh, I'm going to try and fight this, because more likely you're going to tense up and you're going to get sucked under, I guess is the way I was thinking about it. So I thought of myself as a wobbly octopus, which is nice anyway, because I think it's hard to say wobbly octopus as a phrase without smiling. So, or you might think about yourself as a rag doll or a piece of driftwood or something like that, and just letting yourself go flop and surrender to the feeling rather than try and fight it. You'll find it a lot easier. The other thing I suggest is having your birth partner, so whether that's your husband, partner, doula, whoever is coming in to support you on the day, learn some acupressure. Oh, acupressure was such a relief for me during these intense moments. So there's some links I will put below, and I obviously won't go into a lot of detail, but if nothing else, the spots sort of in your lower back, and I've talked about this in a previous video before, but lots and lots and lots of pressure just from your thumbs or your knuckles in your lower back near your sacrum can be really, really good for those more intense sensations. So looking to having whoever's supporting you help you with that at the time. Some people hate being touched during labour, and that's absolutely fine, but I think have it in your toolkit just in case you might want that relief at the time. So I'd say think about that. The other thing is to think about your positioning. You know, every movie, TV show shows women labouring on their back, which is great for an obstetrician because it's easy access for them. But if you think about it, your birth canal, if you haven't actually thought about it before, is not a straight line like this. It actually goes in a J. I know that's more of an L, but let's try and make it more of a J. So baby's going to come down, but they're also going to come out. And if you're on your back, pushing a baby down and then out, that's like the worst possible position to try and push a baby out ever. So think about something called optimal positioning. On all fours, upright, somewhere where you are using gravity to your advantage. It will actually open your pelvis up to 30% or more anyway, so you can get a lot of relief during your labour just by using gravity, making gravity your friend. The other thing, of course, to think about is your language during labour. Now, I don't mean don't swear. Pain research actually tells us that people who swear when they've hurt themselves have a less intense experience, so go for it. What I actually am talking about are phrases, words that confuse your subconscious, that are indirect, kind of wishy-washy. Our subconscious prefers direct statements because they're easier to follow, particularly in that intense fight or flight mode. A direct instruction makes more sense to it, so it's more likely to do what we want it to do. So I mean words like try. Try is a really difficult word for your brain to actually understand because it doesn't actually tell it anything. So if you're saying to yourself before your birth, I'm going to try and have a natural labour, I'm going to try and do this without drugs, or even, you know, just I'm going to try and turn up to this event, more often than not, you won't actually do it because it's kind of giving yourself an out to not have to do something if you don't want to. I'll try to make it as usual what people say when they don't want to say, I don't want to go. So think about using a more direct phrase. I can do this. I will do this. This is manageable. I'm coping just fine. Those kinds of things that are more direct, that's easier for your brain to understand. The other thing to think about, of course, is how you're describing your experiences. So if you focus on the word pain, it's going to make it harder and you will feel pain because you're telling your subconscious that's what to feel, that's what to think about. For me personally, I changed the word pain to sensation. So I started to think about it like this is an intense sensation, but it's manageable. That's an interesting sensation, but it's manageable. So by taking the word pain out of your vocabulary and thinking about sensation, it might be a different word for you. You'll just have to find whatever suits you. But I recommend not focusing on the word pain, because I think once you focus on it, you will feel it. You're just talking yourself into it. So that's what I mean about thinking about your language, which is something we go more into in hypnobirthing classes. So if you attend one of those, you'll learn all about the power of language and how that has great impacts on you having a positive, optimal birth. So if you would like to hear more about my personal induction story, you can actually listen to me talking to the beautiful Ali Krantz on the Circle of Birth podcast. I'll put the link below. That's just come out recently. It was important for me to share a positive induction story because a lot of people don't have such positive induction stories. And as I said, it's not about should you do this, should you not do it. It's just if this is what you're up against, here's how to prepare for it in a way that's positive. If you're interested in anything else to do with pregnancy, postpartum period, parent coaching, or you're a birth worker and you'd like some mentoring in the perinatal area, I'm your girl. Contact me at drerin.com.au or follow me on Facebook or Instagram, and I'll put all those links below too. Thanks so much for watching, and I'll talk to you next time. Bye.